Good afternoon friends, I am Shloka from 9th grade. Today I am going to tell you about diseases. So what are diseases? Diseases cause something to our health and affect us. The disease is an abnormal condition affecting the body of an organism, and these are caused by pathogens called bacteria, protozoa and etc. Disease can be identified by its symptoms. And symptoms are the indications of a disease. And in this we are going to see about classifications and their spread and also agents. Classification of diseases. Number 1. Based on their impact. In that we have two types, acute and chronic. By the name itself, we can understand acute, and we have already come across this word in mathematics. In mathematical language, acute in the sense it is a small angle which lies in between 0 degrees to 90 degrees. Even in biology, acute disease means which occurs in a short period of time and also lasts for a short period of time. Example for this: cold, fever, cough, and etc. Chronic diseases that develop over a large period of time and will not go far in our lifetime. Example for this are cancer, diabetes, heart disorders, and etc. The second type is based on extent of occurrence. Three types: endemic, epidemic, and pandemic. Endemic is the disease which are constantly present in people of certain class or location. In a group of people, if one person gets that disease, then it will automatically spread to that group of people. An example for this is malaria. Malaria is endemic to Africa. The next one is epidemic. Epidemic diseases which are infectious and spread rapidly in many people. And this diseases spread too fast in a short area. Example for this are chickenpox, polio, and influenza. Next one is pandemic. We are in a pandemic situation in the presence of COVID-19. And pandemic in the sense, the diseases which spread across a large area very rapidly. This is also an epidemic only, but these spread in a very large area. Example are COVID-19, plague, and smallpox. And now based on communicability. When we communicate with people, our diseases spread to other people. And infectious, in that first one is infectious disease. The diseases which spread from affected individuals to healthy ones. Examples for this are tuberculosis, diphtheria, hepatitis, etc. Next one is non-infectious diseases. The diseases which cannot spread from one person to another person. And these diseases are caused by us due to our internal functions only. Examples for this are thyroid, cancer, kidney diseases, etc. Next one. How does this diseases spread from one person to other person? Now let us discuss about that. Infectious diseases are also called communicable diseases, and these spread through various mediums like air and the food which we eat and also the water which we drink. From air, when an affected person sneezes or coughs, at that time the tiny particles will come out of our nose or mouth, and that droplets contain microbes. And these spread from one person to another person by traveling through air. Example for this is tuberculosis. And from water, when we drink contaminated water which contains some organic matter, then if we drink that water, then we are affected by some disease. Example for this is cholera. And now by food. If we eat contaminated food, then we are affected by diseases. Example for this is botulism. By soil also we get various diseases. Soil contains some pathogenic bacteria, and these diseases spread through soil are more common in areas where there is lack of basic sanitation. In fields, there will be basic sanitation. So when we place some crops, then if we eat those also, we won't get any type of diseases. And next one is through physical contact. Various diseases can spread through either their actual contact or through sexual contact with the infected person. Contact with currency, door, handles, switches, etc. can be source of infection. An example are AIDS, conjunctives. Next one, vectors. Through houseflies and mosquitoes, we get diseases and they are carriers of the diseases. They carry few pathogens and infect into our body. By that we get diseases. Example for this is malaria. Now let us see manifestation of diseases. Symptoms are the manifestations of diseases. Symptoms of a disease depend on the particular tissue or organ that affected. Cough and breathlessness are the outcomes of various lung diseases. Symptoms like headache and memory loss are due to brain disorders. And symptoms help us to identify the disease. When we see the symptoms in a basic level, then we should go to the doctor. If not, it will cause a big damage. Inflammation, which is often characterized by redness, swelling, or pain, etc., is a sign of injury or infection to our body. Body's immune system produces antibodies to fight against disease causing pathogens. And if we are strong only, these antibodies will produce and able to fight with the pathogens. And principles of treatment and prevention. How can we prevent from those diseases? Treatment is the attempted cure of a health problem following diagnosis. Treatment can involve reducing the effects of the disease or eliminating the cause of the disease. The disease will not be completely cured unless the cause of the disease, say a pathogen, is killed by using substances such as antibiotics that interfere with the life process of pathogen but not the host. There is a necessity of preventing this disease than to cure it due to various factors. Prevention is better than cure. There is a possibility that some people may not recover completely after suffering from a disease due to extent of damage. As I have said you, we need to go to doctor in our minute symptoms only. If not, it causes some damage to our body. The infected person is a source of spread of the disease to the healthy people. Moreover, it can take some time and suffering till the disease is completely cured. General ways of curing a disease can include both public and personal health measures. People living conditions, avoiding, overcrowding, etc. are public health measures. Personal hygiene, exercise, good food and vaccination include personal health measures. And from here, my friend Rama will continue.
Now I am going to discuss about some bacterial diseases.
First, 1 minute, 1 minute. Shake
Okay.
Okay.
and now I am here to continue bacterial diseases. First, we are going to discuss the bacterial disease anthrax. Anthrax is a disease which is caused by the bacteria called Bacillus anthracis. And the mode of transmission of anthrax is soil food. And symptoms of this anthrax are pulmonary anthrax infection can lead to cold followed by the respiratory collapse, means respiratory system gets damaged. And the second symptom is gastrointestinal anthrax infection that leads to vomiting of blood, severe diarrhea and an acute inflammation of intestinal tract and loss of appetite. And the third symptom is cutaneous anthrax infection that leads to skin lesion that leads to ulcer having a black pores, and these ulcers are often painless. Now, the treatment and preventions for anthrax are antibiotic therapy and anthrax vaccine. Dead animals should be burned or buried from all water sources. Now, we are going to discuss another bacterial disease, that is cholera. Cholera is a disease which is formed due to dehydration and the prevention for this is sanitation. It is transmitted by water, food, flies. So the symptoms for this are diarrhea, vomiting and dehydration. It can be prevented or treated by being sanitation and taking nutrition and control of flies. Food shouldn't be kept open and should take anti-cholera injections. Now let us discuss one more bacterial disease that is leprosy. Leprosy is caused by the bacteria named Mycobacterium leprae. It can be transmitted by contact. Symptoms of this leprosy are deformity, paralysis and loss of sensation on skin. And the treatment and prevention for leprosy are vaccine, sanitation, nutrition. And let us discuss one more disease, that is plague. Plague is also called as bubonic plague, and it is caused by the bacteria Yersinia pestis, and it can be transmitted by fleas and rodents. Fleas are nothing but a type of insects, and rodents are nothing but a type of rat. The symptoms for this are swollen lymph nodes in armpit, heavy breathing, vomiting of blood, red urine, aching limbs, and cough. And swollen lymph nodes in groin even. Groin is nothing but the thigh part of the leg. Treatment or prevention for this plague are antibiotics like streptomycin and tetracycline are effective, and control of rats and fleas. And next bacterial disease is syphilis. Syphilis are 4 types: primary syphilis and secondary syphilis, latent syphilis and tertiary syphilis. Now first we discuss the symptoms of primary syphilis. Symptoms of primary syphilis is primary syphilis, which appears after 2 to 6 weeks after initial infection. It shows painless ulcers, usually on genitals, and heals spontaneously. Secondary syphilis. Secondary syphilis, which appears within 2 months, shows lesions all over the body and heals spontaneously. Latent syphilis is a stage where no symptoms are observed. And the last one, tertiary syphilis, is it plays a vital role in our body, and vital organs like heart, brain, bones, and liver are gets damaged. And it is a fatal disease, means it leads to death. And treatment and prevention for syphilis are penicillin and antibiotics. This is the picture secondary syphilis, and here it is primary syphilis. Primary syphilis is caused by the bacteria named Treponema pallidum. And this is one more disease called tetanus. Tetanus is caused by the bacteria called Clostridium tetani, and it can be transmitted by swallowing. Symptoms of this are headache and fever, and difficulty in opening the jaws, and death may occur, meaning it is a fatal disease. Treatment and preventions are cut and wounds should be cleaned thoroughly with water, and anti-tetanus injection should be taken. Here you can see this is the tetanus disease. Next disease is tuberculosis. It is also called as TB. The causal organism for tuberculosis is Mycobacterium tuberculosis, and it can be transmitted by air. Symptoms of this are fatigue, fever, loss of weight, cough, red in mucus, or loss in weight. Treatment and prevention for this are streptomycin, antibiotic, and BCG. BCG is nothing but Bacillus calmette urine vaccine. Now let us discuss one more disease. This is the lungs of a tuberculosis affected person. This is the X-ray. Now let us discuss the last disease, that is typhoid. Typhoid. Causal organism for typhoid is Salmonella typhi, and it can be transmitted by food, water, and flies. Symptoms are headache, fever, diarrhea, and vomiting, reddish eruption on the chest, and loss of weight. Treatment and preventions are sanitation, control of flies, anti-typhoid vaccination. This is a person when typhoid gets looks like. And furtherly, my friend Ananya is going to continue. Now, let us discuss some diseases which are caused by the microorganism called protozoa. First, amoeba is a type of protozoa, as we all know. It causes a disease called amoeboid dysentery. Its causal organism is known as entamoeba and histologia. Mode of transmission of amoeboid dysentery is through food, water, and flies. Symptoms of amoeboid dysentery are weight loss, anemia, which is nothing but blood loss, diarrhea, fever, fatigue, destruction of lining of large intestine, leading to blood and mucus in stools, liver infection. Now, this disease can be prevented using antibiotics such as metronidazole, maintaining proper sanitation, and control of flies. Next disease is very common disease which is known to all of us, which is malaria. Malaria is caused by the organism known as Plasmodium. The mode of transmission of malaria is through mosquitoes. This is a vector. Mosquito acts as vector in the case of malaria. Symptoms of malaria are high fever, chill feeling, headache, nausea, vomiting, diarrhea, anemia, and convulsions. Treatment and prevention for malaria are anti-malarial drugs like chloroquine, quinine, primaquine, and mosquito control. Now, let us discuss some diseases which are caused by parasitic worms, such as lungworm and tapeworm. First disease is Teniasis. Teniasis is caused by an organism called Taenia solium. Method of transmission for Teniasis is through food and water. Symptoms of Teniasis are indilation. If the person is heavily infected due to Teniasis, it can lead to neurocytosteatosis, is that may cause epilepsy, seizures, lesions in blood and in brain and blindness. Treatment or prevention for Teniasis is sanitation, cooking meat thoroughly before consumption. Drug called nicotinamide is used for treatment. Next disease is Ascariasis. Ascariasis is caused by the organism Ascarias lumbricoides. It is also known as roundworm. Now, the method of transmission for Ascariasis is by food and by water. Symptoms of Ascariasis are inflammation, fever, diarrhea, and enlargement of liver. Now, we can prevent these diseases by washing hands before food intake, washing vegetables thoroughly before cooking them. Drugs called ascaricides, which are used to kill roundworms, are used. Thank you so much. Now, from here.
Hello everybody, I am Samhitha and I am going to continue the class from now on. Viral diseases. This is the last type of diseases that we're going to discuss today. So, first let us discuss about a disease which is very dangerous, but a lot of people think that it is very funny and make fun of the people that actually suffer from it. AIDS, Acquired Immunodeficiency Syndrome. This is caused with a virus called HIV, Human Immunodeficiency Virus. And this virus belongs to the genus Lentivirus genus and Retroviridae family. Now, let us see how does it transmit. It transmits through sexual contact and blood transfusion. So, the symptoms included are fever, cold, and cough for the first few days. But in later stages, you can experience a lot of weight loss and nausea and repeated diarrhea. As HIV is a virus which damages your immune system, another bacteria and protozoans also enter your body and cause other set of diseases simultaneously along with AIDS. So let us see some examples of those kind of diseases. First, the neurological diseases which you might experience are encephalitis and meningitis, and the diseases which can be caused to the eye are retinitis. And for lungs, pneumocystis and pneumonia, tuberculosis, and tumors in lungs. And you can also find tumors on skin and your intestine. Other gastrointestinal diseases include esophagitis and chronic diarrhea. Next, chickenpox. Now, a lot of you know about chickenpox. So, chickenpox was one of the very dangerous diseases and killed a lot of people during 17th, 18th, and 19th centuries. And I'm sure a lot of you must have experienced chickenpox and suffered through chickenpox. So, can anybody answer me which virus actually causes chickenpox without seeing the screen? Okay, let me tell you. The virus which causes chickenpox is varicella zoster virus, in short, V2V. This virus belongs to varicella virus genus and Herpes viridae family. This can be transmitted through air or direct contact. So be careful when you visit any of your friend or relative who has chickenpox. Be careful that you do not get into touch with him or do not get in contact with that person. So, what are the symptoms that you get with chickenpox? At the beginning, you can experience fever and decrease in appetite for food. But the main symptom is reddish rashes that form on your chest and your back, which cause a lot of itching. So how can you treat it? Well, the first thing to do when you have a person infected by chickenpox is to isolate the person from other people. This can reduce the spread of the disease. So the next thing to do is actually a bath every 4 hours with water containing baking soda. This can really soothe the itching. Then there is also a virus, varicella virus, which can be used to prevent chickenpox. Next disorder is foot and mouth disease. So foot and mouth disease is one of the odd one outs in all of these diseases because this disease doesn't affect human beings. This disease affects cattle and animals like and hoofed animals like horse, deer, goat, etc. So this disease is caused by foot and mouth disease virus, which belongs to Acrovirus genus of Picornaviridae family. Now, this can be transmitted through air, objects, and also animal vectors, including humans. So, what are the symptoms? First of all, this disease is a very highly contagious disease. That is, it can spread very fast. So, when any of the hoofed animal gets affected by this disease, they can experience blisters on their mouth area and their foot area. Due to the blisters on their mouth area, they also experience excessive secretion of saliva. Next, so there can be also symptoms like weight loss and also decrease in milk production from that animal. Also, along with this can be a little bit serious also because this can cause inflammation of cardiac muscles, which can also cause to death. And the treatment can be by using disinfectant on the infected area, and the best way is to prevent it by using FMD vaccine. And a lot of cattle herders actually prefer using FMD vaccine on their cattle. Next. This is a picture of foot and mouth disease and the blisters on the mouth of the cow. Next, hepatitis B. Hepatitis B is a virus which is caused, hepatitis B is a disease which is caused by a virus called hepatitis B virus, which belongs to orthohepatnavirus genus of Hepatnaviridae family. This can be transmitted through sexual contact or blood transfusion. So, hepatitis B virus is one of the diseases which might occur when you actually get in contact with HIV, which we've discussed earlier when we were talking about AIDS. So the symptoms of this disease include vomiting and jaundice, etc. But in the later stages, you can also see liver inflammation, liver cirrhosis, and liver cancer. So this can be treated by using antiviral drugs, which can prevent hepatitis. And hepatitis B vaccine is also present for preventing this hepatitis B. Next. This is the picture of the hepatitis B virus, which affects your liver. Next. Poliomyelitis. Poliomyelitis is caused by the virus poliovirus, which belongs to enterovirus genus of Picornaviridae family. So this can be transmitted through food and water. The symptoms include fever and headache, but in the later stages, you can also experience severe muscle pains and paralysis. The best way to treat it or prevent it is by having proper sanitation around, and you have to make sure that the houseflies and mosquitoes number is in control. And also there is polio vaccine, which can prevent polio from occurring. Polio vaccine was once administered in India on the name of a program called Pulse Polio Vaccine Program, which administers vaccines to the people to the children of age below 5. Next. This is a child who has polio and actually is getting treatment. Next. Rabies. Rabies virus is a virus. Rabies is a disease which is caused due to the virus rabies virus. This belongs to Lissa virus genus of Rhabdoviridae family. This can be transmitted through dog bite. The symptoms of this include fever, headache, fatigue, hallucinations, paralysis, and you can also experience some inability to swallow, and at the end, death may also result. So, when you have a wound of a dog bite, you have to make sure that you wash the entire infected area with antiseptic. And immediately, the patient should seek immediate medical attention. Also, there is an anti-rabies vaccine for dogs as well as humans, which can be administered so that you can keep rabies away from you. Anybody has a question?
Yeah, I have a question.
Yeah.
Do humans get infected by rabies?
Yeah, they do get infected, and some people say that the humans who get infected by rabies actually behave like a dog, which might be true because rabies is a disease rabies virus is a virus which actually infects your nervous system. So this might actually change your nervous system, and as I told you, hallucinations may occur, which may result in the human acting like a dog. But it may be true or it might be true, but it may not be true, but it has happened in some cases. Now, let us discuss about some fun facts on our human body. So, our mouth actually produces about 1 liter of saliva each day, which is quite surprising. It's almost the water everybody drinks, right? Yeah. And sometimes the brain is more active when you're asleep than you're awake. I think that's why that's why your dreams are more creative than the things you do awake. When you sleep, the dreams you get are very creative than the things which you do awake. So maybe your brain is more active when you're asleep. Next, laid end to end, an adult's blood vessels could circle Earth's equator 4 times, which is a lot. In adults' blood vessels, there are a lot of blood vessels in adults, even in a child. And having said that, adults' blood vessels could circle Earth's equator 4 times. The word muscle comes from a Latin term meaning little mass, which is what ancient Romans thought flexed bicep muscles resembled. Next, bodies give off a tiny amount of light that's too weak for the eye to see. So even our bodies actually give out a little bit of light. But our eye can only take the light of specific frequency and wavelength. And the light which is emitted by our body is of very less wavelength and frequency. So it's very hard for the eye to see the light emitted by our body. Thank you very much for listening to our class. I hope you like our presentation and enjoy the class. Thank you so much.